Alli, have you thought about where you're going to spend your golden years?
Absolutely. I'm living it up independently till I'm 110. At least that's the goal. However, what we know is most of us actually are going to need some type of assistance at some point in our life.
And that's why we're so excited to talk to Jana Yawn, who is a registered nurse, or administrator and owner of Lakeview Retirement Center in Baxley, Georgia. And she answers some really important questions for us.
And before we get to the episode, we want to give a shout out to a Girls Talk Healthy Aging listener, Miss Heather Luna. Thanks for listening. Let's dive in. Welcome to the Girls Talk Healthy Aging podcast, where we dive deep into pressing health and fitness issues facing aging women. I'm Alli Kerr.
And I'm Shawna Kaminski. And together we'll bring candid conversations, expert advice, and personal stories that will inspire and empower you on your own wellness journey.
I can't wait to have this conversation. Jana Yawn, we finally made it happen. Welcome to the Girls Talk Healthy Aging podcast.
Thank you for having me.
I know I'm ready to have this, and I know Shawna said the same. We've been thinking, we asked ladies, like, what do we need to have on the podcast? Who do we need to have? What is a topic that we need to have, that we need to address? And this is one that came up, and we were like, duh, why didn't we think of this? So, Jana, can you tell us a little bit about Lakeview Retirement Center and what you do? And then that'll help people to understand kind of how this conversation is going to help us.
So, Lakeview Retirement Center is a personal care home. It is a small personal care home. We are licensed for 15 beds, and we take care of patients that are most of the time in their, I would say, older life, from 65 to 105. We have had a patient that was 105. But we take care of assistance with ADLs, which is activities of daily living, such as bathing, grooming, those type needs. But we also do meals. We do breakfast, lunch, supper, snacks. We take care of laundry, cleaning, pretty much everything we do it here. Medication administration, really just anything that you could need, we take care of it here, but we try to have a smaller environment to make it feel more like home. Because at that stage in life, most patients are trying to stay at home as long as they can. So in a nutshell, that's what Lakeview Retirement Center is. It was a dream of mine for quite some time. I did home health nursing for a while and saw the need for that. That is something and we're in a rural area, so we happen to be the only personal care home in our county. So it is a need, and I see it just being more of a need as we age.
Jana, what would be a sign that someone is ready to move to assisted living? It's just such a hard thing to, for family members, because people might not make that choice themselves. So what should we be looking for, say, in our parents?
So you're right. Most of the time, the patient is the last one to make that decision, because a lot of times they don't see the need. What we see is if someone becomes unable to cook for themselves or clean, or you notice that instead of eating healthy meals, they're eating crackers every day, or they're having trouble with their medication administration. A lot of times you'll find just complete noncompliance with what the physician has ordered. And a lot of times that's because they just can't remember what they're supposed to take or what they've already taken. So with that, I would say watch for those type clues. If you see that your loved one is no longer showering, or their appearance is unkempt, those are just clues that you may need to be thinking about that. Unfortunately, it seems a lot of times that a person has to start falling before somebody realizes, we have a problem. And then, unfortunately, sometimes by the time they've started falling, it can be too late, because then you have things that are broken, or So we really try to have people move in before they get to that point, because sometimes if you wait that long, then you do have to go to a skilled facility such as a nursing home, and which those are great facilities. I'm glad we have them because they're needed. But a lot of people are trying to stay somewhere that's a little smaller, where hands-on care is a little more prevalent.
Tell us the difference between assisted living and personal care home, because I know that was I called the Lakeview Retirement Center an assisted living, and you corrected me. So what's the difference? What are the different things out there?
So, and one of the reasons I corrected you is the state of Georgia has rules, and in those rules, it says that a personal care home may not, advertise as assisted living. And pretty much what it appears to me, the biggest difference is assisted living is more for your independent type. Maybe they just have a few things going on, or maybe they are lonely, or maybe they're afraid to stay by themselves, but they can still do a majority of their ADLs. That may be more for those type people. Personal care homes are a little more for people who need a little more assistance. So if you have that one that's needing regular medical care, then I would say a personal care home is probably a better option if you're looking for that smaller type facility.
Could you share some strategies to make the transition, or to even bring up the idea of moving into assisted care? How can a family member make it easier for their loved one to make that transition if they're resistant?
That's a really hard question. And the reason why I would say that's a really hard question is so many people are so different. Not one person is going to handle that conversation the same way. I would say, talk about it early, have plans, and don't just spring it upon them. That seems to be a really bad situation when someone is just kind of out of the blue, this is what we have to do. And a lot of times that comes from being afraid to bring that conversation up, but it's needed. And I do think if you have talked about it beforehand, and just take those steps of, this is what we're trying now, but if this doesn't work, because unfortunately what I see is a lot of really, really good families who are trying their very best to do what is right and what the patient wants. However, sometimes those are not the same thing. We have a lot of families that are still having to work. It's like we're living longer, but we're having to work longer. And not only is that person having to work longer, now they're trying to help take care of grandchildren as well, but they also have an aging parent. So I have a lot of families that some of them come to me and they feel like they failed, and they feel like it's been a letdown, but they simply cannot go any further. And I just think sometimes if we could catch it before we get to that point, because it's not a failure, you're just trying to simply get the best for the situation that they're in. And but I do think if you talk about that ahead of time, before you ever get to that may start the conversation going better than, this is what we have to do now.
We're going to interrupt this interview for just a second because we've got something we want to make sure that you know. If you're struggling with your health, with your fitness, if you don't know where to start, or you know what to do and you're not doing it, we're here for you. And all you need to do to get our help is to reach out to Shawna and I at our email, sapodcast23@gmail.com. And we're happy to help, and we will be in touch. Now back to the show.
So I'm definitely hearing that we tend to wait too long to get to this, and there are extra challenges that come with that. So how soon should we really, what does that look like? If we do it at the right time or early enough, Jana, what does that look like?
But there again, that's a hard question because I do see so many different dynamics. And I always want that person to be at home as long as they can. And in this business, that's kind of hard for me because this is what I do. But it is always my hope for someone to be able to stay in their home as long as they absolutely can safely. And I think that's the key word, because nobody wants to work their entire life to just have to give it away. And that's what a lot of them feel like they're doing. But you just have to look at the safety of things, and which a lot of patients, once they're here in a facility, they actually begin to thrive again because they are getting those healthy meals. They are taking their medications correctly. They're socializing with people in their age group about things that they like, and they have general, likes that they share. And so socialization is a huge part of this age group. And I think that's a big thing that is kind of, they don't have a lot of socialization anymore. But knowing that exact right moment, I think that's just kind of each person individually. Because like I said, I'm an advocate too for staying home as absolutely long as they can, because I think they deserve that. But I also know that there is a safety issue that does come into play. So that may not answer exactly.
Well,
That's
I'm even thinking about my parents who are, definitely home taking care of themselves. But is that, maybe that's a conversation to go ahead and just start having, like, as far as their wishes and their wants, and, just, I think that what I'm hearing you say is if we wait too late, it just is
Probably
there's more difficult and more resistance, and we don't really know we might not know what their wishes are, depending on what's going on with them at that point.
Yeah. Well, and the too late too. One thing I mean with that is, we have rules that we have to follow in the state of Georgia, and if you get to a certain need level, then you may only have one option, and that's kind of what I try to tell people. I'm certainly not trying to scare them any which way, but I just want them to have that information that once you reach a certain point, then a skilled nursing facility is all that you have left, and thank goodness we have those. But, I just want everyone to have those options.
Can you tell us some things that would take those other options away when you get to a certain point and it's, just have one option left? What does that look like?
When you require more skilled nursing care, such as, if you become less ambulatory, have more trouble with ambulation and transferring and those
and I'm gonna get you to use, I know I hear these words because my husband works in hospice, but for most people they might not know what ambulatory means. I know what it means, but can you explain that for us?
So a lot of places you got to be able to walk.
Got to be able to get yourself up and get out. Like if there's if there's a fire drill, you've got to be able to get. I mean, like the laws.
You got to be able to get up and get moving for, and a lot of that does base off of safety for fire purposes and those type things. Now, not to say that you have to be able to hop up and jump in the car, but there is a limit there, and that's kind of where I'm going with that, and a lot of times that's where you see that person who has stayed at home and had multiple falls, and then they get to where they're not able to get out of the bed, and that's mainly that person that I'm talking about.
Yeah. And so that leads me to my next question, which is talking about aging in place, what that is versus facilities that do offer that versus don't offer that, and what that is for people that have never heard of that terminology.
So one thing I have noticed is some people are hesitant to do a personal care home because they're afraid, once I do start to need more specialized care, will I have to transfer somewhere else? After I'm used to this, am I going to have to go somewhere else? And the state of Georgia does have aging in place. Now, of course, each facility has to follow those regulations based off of their license. But there are things in place where you could age in place and, continue to live in that facility even up until your death.
And that means, let's say that you come in and you're very ambulatory and you're able to do a little bit more for yourself. But then as you continue aging, you get to where you're able to do less and less. My understanding is instead of now having to transfer to a nursing home, you can stay in that facility because that facility, depending on their certification or what they have, that you can, some facilities you can stay there even as you become less able as you age. Is that what I'm hearing?
That's correct. That's correct. And some, facilities may have different numbers that they can go by. And of course, with state regulations, that changes frequently. But our number right now is 4. And we're nowhere near that. So that person, the administrator of that home, would work to make sure they're able to keep and take care of their patients. Because that's, when you move into a small facility such as ours, you really do become family. So, we do everything possible to be able to take care of you through end of life because, I just think it's better for the patient. I know it's better for the patient, the continuity of care, and it just makes for better care that way.
And when you say 4, you're saying that you can have up to 4 patients out of your 15 that would require a good level higher of care. Is what I'm okay.
Right now, that's the number right now. Like I said,
and different states maybe. We have listeners in different states and different countries, so this could be different depending on where you live. So that would be good to check when you're looking into this or finding out information on this.
What are what's the transition like for your patients that are moving from home into your care? What are some of the challenges and how can they best settle in?
The biggest challenge I have found with that is a family having made up their mind, like they know that this is what we have to do. They've tried everything else. They've went through private sitters. They've tried to stay with the person. They've exhausted all other options, and they know this is it. We've got to do this, and they somehow can't relay that to the patient, and they can sometimes almost give false hope of potentially going home. And to me, I tell my families right off the bat, if you don't have any means or that's not an option, take it off the table. Don't do that. And also we have to let them get used to things. We usually ask them to give us 2 weeks for a routine to kind of get in place, for us to figure out their routine, for them to figure out our routine, because they are still very independent. They still have their options. They still have choices. And we're just kind of trying to learn each other during that time. From what I've learned, usually 2 weeks is pretty good to kind of tell you, whether they've kind of caught on, and usually they do. I haven't had a lot of issues with that, but I do like to tell the families, if there's no hope in them going home, take it off the table. That's just harder on everybody, especially them.
And what are some things that you see as far as when someone comes in, kind of walk us through, like, what is that first week? What do the first 2 weeks typically look like for the patient?
I would say, a little bit of apprehension, of course. Most of the time, we do have some who have come here voluntarily. They know it's best for their children. They've seen their children work themselves to death almost, trying to take care of them and their family and their jobs and everything that goes along with having parents that are living longer. That's just part of it. So some of them do. They come here on their own, and you can tell from the first day that it was their decision. And those that are a little more hesitant, and especially when you do have some forms of dementia that come into play, that always makes everything harder for sure. But like I said, they really enjoy the socialization of people their own age talking about things that happened when they were younger, things that are relevant to them. So that helps us to transition a lot better when they have people here that are their age and they can talk about things that they're interested in.
Yeah, I was really fortunate. My dad and stepmom chose to go into, it was more of a retirement home, but there was the option for more assisted living. And that was such a relief that they made that decision. It was after my dad had his first stroke. And I can attest to the fact that it was just like a big thank goodness that he has decided. And even though there was aspects of moving in that were not to his liking, he just knew that it was best. And we had not had that conversation, but I really appreciate that piece of advice of talking early about it. And I think that would make the conversation easier to come up when it was greater. So that's a great piece of advice.
And what you see a lot of times in that life stage is a lot of denial. Once you get to that point, there's a lot of denial about what you can and can't do. So, if there's a plan in place, where you can fall back on that plan, and say, well, this is how you viewed this before, and this is where we're at now. Like I said, everyone's different. There's no handbook. I've learned that. I get questions a lot about, especially dementia patients, because we deal with a lot of dementia, and there's no right answer. What helps one person will absolutely not help at all for someone else. It's just very, very tough. And that's why those patients really, really have to have all of our patients, because it is a very tough thing to deal with and to try to help them through it. It's difficult for them as well, much more difficult on them than us. So, those conversations I feel like need to start early for sure.
And I've heard different terminology. Like I hear you using the term patients. At assisted livings, I've heard the term residents. Is that something that's different based on kind of the type of facility, the type of services that are offered?
Honestly, that is probably just me going back to my 15 years of nursing.
Nursing, that's what I figured.
Because our people here are residents. I don't know why I'm saying patients. I guess because of my nursing background. But yes, they are residents here because this is their home. They just share it with other people.
Yeah, no, I figured that was the nursing thing going for sure.
Definitely.
Tell me, this is your passion. You bought this facility. You're in it now. Like, what are the challenges for running a personal care home type facility? What are your biggest challenges?
I would say my biggest challenge is our area. We're very rural in South Georgia. I'm sure you can't tell by my accent. But a lot of people in our area are not financially prepared for this stage of life. It's very, very sad. I get numerous phone calls almost daily, and they're just not prepared for this time in life. And, everything is expensive now. We do pride ourselves on being one of the most reasonable homes in our area. We are also much more reasonable than paying a private sitter. We've ran all of those numbers, because when you're paying a private sitter, you're paying an hourly rate, plus you're still having to buy food, pay for utilities, such as that. So we pride ourselves in being very reasonable. But at the same time, it's very heart-wrenching when there's people who want to be there with you, but they can't afford it. And I've even had to take a step back. My accountant is very helpful in reminding me, that I have to be able to run a business. And but as a nurse, I do have a heart for people. And sometimes her favorite quote is, "You're running a business, not a charity." And I have to keep that in mind, because it is very important. And a lot of healthcare facilities are dealing with a lot of staffing issues. I don't have a lot of trouble with staffing. I'm very blessed. I have wonderful staff. Some of them have been doing this longer than I have been, much longer than I have, and they're wonderful at what they do. So honestly, and I tell some of them, if it weren't for them, I don't think I would have made it these 3 years for sure. But there is still some turnover, and that's everywhere. That's not just healthcare now. That's everywhere. The hard thing for healthcare, though, is when you have turnover, you have to go through fingerprinting, background checks. You have to do drug screens. You have to do all of this education and all of this file keeping that some places don't have to do. And so being a facility that's open 24/7, We're open holidays. We're open hurricanes. We're open ice storms. You know, and I've been blessed with staff that made it happen and made it work. But that is very difficult, a facility that never closes. So I think that would be my two main ones.
And on top of the staffing issues, you don't want a lot of staff turnover because that's difficult on your residents. Because I'm sure as residents become family, staff feels like family as well.
Yes, definitely.
Yeah. Now I'm in Canada and you're in Georgia, and finances are different everywhere. Would you be comfortable in giving some kind of ballpark idea of what it might cost for assisted living?
So and once again, I know we are personal care, so I can't speak for everyone in our area. But just a ballpark, you're looking at, and my residents are private pay, so that does make a difference. I don't have any government assistance; they are all private pay, and so private pay rates in our area are normally around $4,000 a month. Then you can go all the way up to $10,000 for some of our skilled nursing facilities, and that's monthly. So, but you're looking at people that are having to private pay. Now that's different for people that are under certain waiver programs or government type programs.
Well, this is another reason why we are encouraging healthy living, because we definitely want our listeners and ourselves to be able to live on our own and not be in a situation where you're paying $10,000 or more monthly to be taken care of. But that's the reality, because there's so much we can do as our younger selves to make it easier for ourselves when we are a little bit older.
And what can we do to prepare? Because you said a lot of the struggles in the rural area is that people haven't prepared financially for this stage of life. What are some suggestions that you have based on what you've seen that we need to be thinking about or doing?
Alli, I don't know that I've got that answer yet. Because like I said, I stay heartbroken a good bit of the time because of the phone calls that I receive. And I really don't know what that answer is, because between me and my husband together, we have about 5 jobs. But we're not ready. We're not prepared. And I'm sitting here telling you that people aren't prepared, and I'm one of them. I don't know what the answer to that is. I really believe that it's going to have to come down to some type of government help with that. And like when I was saying earlier that some facilities are upwards of $10,000 a month, those are skilled facilities where they have to have so many nurses on staff, and that is where the difference comes in. It's very expensive. These places are not just making a whole lot of money like people would think. I know firsthand. It's going back out. Insurance is just astronomical for these type of places, and I don't know what the answer is to that. I do think there's going to have to be some type of assistance for those type of people, because we're looking at people with retirements, a lot of them that have worked and they're over a financial bar, I guess, but you still can't afford $10,000 a month.
Not
I don't know where the answer comes there.
Yeah.
Yeah.
My first thought is stay healthy so that hopefully you won't have to go there.
Yeah.
But things happen, and
Yep.
it's just the reality of it. But yeah, that is
something to think about, though, that we
are
not thinking about.
Correct. Yeah. And that's why, I'm always, when I'm going for my workout that I don't want to go for, or I'm, having a salad when I'd rather have French fries, I'm like, I'm preparing for that other time in my life,
Yep.
So that's one of the reasons why we do this podcast, to create awareness and not just to have knee-jerk reactions to this sort of thing. If we know this is potentially coming, then education is the best way to prepare in a way. So what kind of resident is best suited for your facility? Are there some people that thrive and some people that do less well? Any comments there?
Definitely, the ones that thrive are definitely those that have they have in their life, they have been, their career took them where they were always around people. We have a lot of school teachers, type of people that work in public jobs like that. They seem to thrive here because they were missing that social interaction. I really, and I'm be honest, I didn't realize how much the socialization mattered until these past 3 years of opening this. At their age, it matters a lot, and they want to talk about things that they're interested in. Do they absolutely love talking to grandkids and family? Of course, they live for their grandkids, but they also like to talk about things that they were interested in, and they don't know a lot about all the social media and the technologies and stuff. So, they just like to talk to someone that's interested in what they are. So that does make a big difference. And those people do seem to thrive together.
I know that my dad was a very people person, but he didn't do very well because of his hearing, and he had hearing aids.
Yeah.
He just couldn't adjust them. And I
Yeah.
know that there are small, that's not a small thing, but it's something like that really colored his experience there. But that would have colored his experience anywhere, and I'm sure that's probably a common theme with older people. And I mean, other than adjusting people's hearing aids or getting them to get hearing aids, any solutions there?
Yeah. And you're right. Being hard of hearing is very, very difficult because you don't always interpret things the way they were intended. And sometimes that can really, really cause feelings to be hurt, tempers to flare. I mean, we are dealing with people, and we all have emotions that we have to deal with. But yes, being hard of hearing, and especially if you have a man such as your dad that was used to taking care of himself, doing things himself, his way probably, and that's just frustrating for them, and it kind of starts a snowball effect there of they just kind of give up on certain things.
Yeah, and retreat. So
Yes.
if you notice that people are retreating, maybe they came in and they were a bit more gregarious, and then over time they just kind of shrink back. Do you have ways to help them maybe have discussions? Because sometimes family members wouldn't know what to do.
So I can attest to us being a smaller facility. We are licensed for 15, but we stay full with 13 residents because we keep all of our rooms private instead of having semi-privates. And because of that, our staff is really in tune to the everydays of each resident. So they're very quick to catch on to that, like what's going on with Miss A, what's going on. And so that helps a lot. I mean, we are able to know if they skip one meal. And that's just because we are so small. But when you do see that, you can sometimes just a little more one-on-one attention can help that. And then we do have to be careful too, though, because these are adults who deserve their independence. They deserve to not talk if they don't want to talk. So they do still have residence rights that, we have to follow. And, but, we do have ways of, and everyone's personality. And that is, like you said earlier, just as our residents become family, our employees are family. And I know that we're not technically, and the technical term, I guess we shouldn't feel that way, but we do. And I think we treat them like I would want my family treated, and that's kind of what I thrive on with them is. And my motto is the residents first, everything else I'll handle later. So that's just, we do aim to put them first in everything. So
what about if someone is like let's say it's getting to that time, or, you're at least in that process of thinking about this, or maybe you're at the process of, okay, we got to do this now, it's time. And you maybe would go visit places, check out places. What should people be looking for?
Yeah, so definitely visit. That you can tell you a lot just from walking into a facility. I would say visiting. Also, of course, we're in a very small rural area, so word of mouth travels faster than anything. But we have reviews from people that have had loved ones here, and they spell out in those reviews, my mom was there, this happened, and it's word of mouth. And we have families that their loved ones have passed away a year ago or 2 years ago, and they still support us wholeheartedly. And to me, that says more than anything, that they're willing to still support us. And when I say support, they still come by, they still visit, they still pray for us, they still drop cakes off. They are still very much involved with us. But that's a testament to the type of community that we have here in Baxley. So
I like how you said, I run my facility as, I would like it to be run for my family. And that having a heart-centered business like that is, it's so rewarding, but probably you, like your accountant said, you have to be very careful because it might not be financially rewarding. So good for you for having that heart-centered business. If you had a wish for our listeners, what would it be?
Honestly, if I had a wish that everyone, it would be that they never needed this service. I truly would wish that for everyone. But the reality of what I've been doing and being a nurse for so long, that's just not everyone's reality. And more than not, you're going to need help when you're older. And people are living longer. That statistics show that. So that's something that you just got to be prepared for. And my wish is that you do find a facility wherever you may be, Canada, Macon, Georgia, or Baxley, Georgia, that you do find a facility where the staff treats you like they want to be treated, because the golden rule still stands. If you treat people how you want to be treated, I think you'll do okay in life.
And my wish would be that we listen to this podcast and then we go out and start having those conversations with the people in our lives so that we don't wait too late.
And I wholeheartedly agree with you, Alli. My parents are sadly gone, but this is a conversation that I will have with my kids. Having that conversation when I don't need that sort of thing would ease my kids' mind. So I hope that people do some big thinking and converse, whether it's for the care of their own parents or the care of themselves.
Thanks for listening. You'll find me, Alli, on Instagram at Alli Kerr Fitness.
And you'll find me, Shawna, on Instagram at Shawna Kaminski. Feel free to pop us a DM with questions and or feedback. If you're enjoying the Girls Talk Healthy Aging podcast, please subscribe and share it with other health-minded women. Ratings and reviews are also much appreciated and help us get our message out to a larger audience.
Until next time, be healthy and be happy.